Here is part 3 of our musculoskeletal conditions. We're going to focus on OI, or osteogenesis imperfecta. Osteogenesis imperfecta is characterized by fragile bones that break very easily, and so it's a congenital bone disorder, also known as brittle bone disease, again, because those bones become very, very brittle, or are very, very brittle, and they can have several fractures from very simple types of things. One of the videos that's on here that I'm recommending that you watch, they say that even a sneeze or a cough could break a rib for some of these individuals. Other problems are going to include muscle weakness. You'll see that because their bones are very brittle, that there is curved bones, and so those curved bones may affect how those muscles and ligaments and tendons all line up. So again, you may have that soft tissue shortening. You may just have weakness because you can't use those joints or those bones as much as possible, those kinds of things. Because you do have curved bones, you may see a scoliosis, which is sort of a curved spine, and there's going to be a separate series on that, or a separate lecture on that. You may see that brittle teeth as well. It's characterized with hearing loss. There's a lot of fatigue, joint laxity, or instability, you may hear that referred to as, and again with some respiratory problems. And so another video that I'm recommending that you watch, you'll see a very short individual, right? A very short person, so there's not a lot of space for her lungs to fully expand, and that's going to affect respiration. There's different types of osteogenesis imperfecta, where some are more severe than others. Okay, so the incidence is 1 in 20,000 births. And again, if you have a mild case of osteogenesis imperfecta, you may have few fractures in your life, where if you have a very severe case of osteogenesis imperfecta, you could have hundreds and hundreds and hundreds of fractures your entire life. Osteogenesis imperfecta is caused by a mutation of a gene that looks at type 1 collagen formation. And so type 1 collagen formation is actually found in skin, ligaments, tendons, and it actually causes demineralization of the bone and even dentin with your teeth. And so it is not caused by poor nutrition. It's not caused by too little calcium, or it was nothing that the mother did when she was pregnant, like, oh, you didn't drink enough milk. No, it's not that. It's a genetic condition that affects type 1 collagen formation. Okay, so it's a genetic condition that affects type 1 collagen formation. Osteogenesis imperfecta affects men and women, boys and girls, all the same, as well as it affects all racial and ethnic groups equally. Approximately 25% of children born into a family have had no history of osteogenesis imperfecta. So again, a fourth of children that are born to families, there's no history of osteogenesis imperfecta in the family. However, most cases are inherited from the parent, and they may not even know that they're a carrier for it. So a person with osteogenesis imperfecta, if they do have osteogenesis imperfecta, there's a 50% chance of passing it down to their children. So again, it has a pretty significant genetic component to it. They diagnose OI by doing some sort of ultrasound exam. Typically, that's done at 16 to 24 weeks gestation. in which case a type 2 osteogenesis imperfecta is usually apparent at less than 20 weeks, because with that ultrasound exam, they can actually look at the bones and look how they're forming, those sorts of things. They can also diagnose, excuse me, they can also diagnose osteogenesis imperfecta by certain types of doctor's examinations. A doctor would more than likely be able to tell if somebody has osteogenesis imperfecta or if they're being abused by a caregiver or somebody because the fracture itself looks different, and we'll take a look at that. They recommend genetic counseling for those individuals who have osteogenesis imperfecta who want to have children. Again, it can be very dangerous because, again, if the mother is the one that has osteogenesis imperfecta and that baby kicks her ribs, she may have a high likelihood of fracturing that rib. That rib may puncture her lungs, her heart. It may puncture the amniotic sac. I mean, it's a very high risk type of pregnancy, and so they do recommend that genetic counseling. When they look at the number of fractures in an infant's body that has osteogenesis imperfecta, quite commonly the arms, ribs, and legs are what's fractured, and again, with X-rays they can tell what kind of fracture that is, and go from there. When diagnosed in utero, a lot of these pregnancies unfortunately end because, again, there are multiple fractures that are even occurring in utero to this particular child, maybe for kicking the mother's rib. The child breaks their legs or bones in their foot, and maybe they hit their head or bump their head, and it causes intracranial bleeding. And so there can be fatality to these infants, unfortunately, too. Quality of life is very difficult to predict, and so there may be multiple surgeries from fractures. They say that respiratory failure is the most frequent cause of death, and again, when you watch the video, you'll kind of see how those bones are affected and how there's less space for their lungs for them to breathe, those sorts of things. Unfortunately, there's no cure for osteogenesis imperfecta either. As I've alluded to before, there's different types of OI, and so there are, let's see here, four types of OI. Type 1 is considered the most mild and the most common. They have mild fragility with their bones, and as a result, they have fewer fractures and they have minimal limb deformities. They do have a lower type 1 collagen, however, it's still considered normal for a structure, in which case the infants tend to be normal height. They typically have less fractures at birth, whereas somebody who has a more severe type of OI, I mean, you think of passing through the birth canal and how traumatic that is. There could be several fractures just from the birthing process. Interestingly or ironically, there may be a bluish discoloration of the sclera of the eye, and they do have the high incidence of hearing loss as a young adult. Some issues that we may see is just a global developmental delay. There may be many reasons for this. If they know they have a diagnosis of osteogenesis imperfecta, their caregivers may be limiting their physical activity as precautionary to avoid those fractures. Okay, instead of saying, kid, go outside and play, or jump on the trampoline in the jungle gym and jump off the swings and go down the slide and climb up the tall ladder. They may be a little bit cautious with that, and as a result, they may not have the exposure, they may not have the experience, and they may have that developmental delay. There also may be developmental delay because there may be some type of limb deformity, which is affecting their musculature, which is going to affect how they move, and it's going to affect how they function. Related to that, again, you may have that muscle weakness, and you may have that joint or ligament instability as well. And then you're dealing with fatigue, and you're dealing with those types of issues. So as an OT, we want to kind of went off on a tangent there. For our treatment, we should focus on increasing that mobility as much as possible, increase peak bone mass, and develop that muscle strength. And actually, they say high levels of exercise and high levels of physical activity are encouraged because that helps improve their overall outcomes with function. And it helps improve their overall outcome with bone density, those sorts of things. And so if somebody does have type 1 osteogenesis imperfecta, it's important to keep safety in mind, but there's also safe ways that we can use physical activity and physical exercise, those sorts of things, to help increase their overall development. Family members should always carry, and you should encourage this, that family members should always carry documentation of the diagnosis of osteogenesis imperfecta, because if they frequent emergency rooms with fractures, those sorts of things, they may be accused of child abuse, and it would be just awful if a social worker came up and took the child immediately away into Child Protective Services, and then they had to deal with that trauma also. So again, they should be encouraged to carry some sort of documentation with them about the diagnosis. Type 2 is the most severe form, and here they have improperly formed collagen. So type 1 was the least affected, and they had formed collagen. Here it's improperly formed. Unfortunately, since it is severe, many babies are stillborn or they die soon after delivery because, again, of their respiratory cardiac complications. They have higher incidence of in utero fractures in the skull, the long bones like their legs, their arms, the vertebrae, those sorts of things. Those that are born have shorter limbs, have a very small chest cavity, have very soft skulls. Their legs are in sort of a frog-like position because they're pretty much have hip dysplasia. And as a result, again, they're having those respiratory swallowing problems. And again, with their eye colors, the scleric are very dark or a blue-gray type of a color. So type 2, most severe. A lot of these babies die in utero or shortly thereafter. Type 3 is considered children who survive that neonatal period, but it's considered to be the most severe. So it's the most severe type of those who survive the neonatal period. They also have very severe bone deformities. You'll see the little girl, one of the little girls in the video has those severe bone deformities. Respiratory and swallowing problems are common in newborns. Again, because of that short space in their rib cage, it's going to affect their lungs. They typically have a very short stature. Their head is usually bigger related to their body size. The sclera of their eyes is white or could be tinted blue, it may look a little purple or gray. And so here, as an OT, again, we're going to want to look at safety and prevent fractures. We're going to look at respiratory function. If they're having trouble breathing, if they're having asthma, that's going to affect their mobility, that's going to affect their function. I would hope that somebody would have respiratory therapy as well. But again, with the treatment plan, if you're looking at maximizing mobility, function, range of motion, those sorts of things, and they do have that shortened space, they are short, and so their lungs don't have a lot of room in their chest cavity, I would hope that we would take a pulse ox and sort of monitor their oxygen levels as we're trying to increase that mobility and function. Emotional support may be quite large. Obviously, they can't participate in a lot of what their peers want or what their peers are participating in. They may need strategies to cope or adapt with their short stature, with their frequent fatigue, those sorts of things. So again, our plan as OTs may be looking at maximizing mobility and function within their home, within the community, looking at school. A lot of times these kiddos are in wheelchairs, and so you may be looking at maximizing their mobility, what's safe in wheelchairs, what type of wheelchair is safe for them, those sorts of things. Preventing falls would be a significant area in our treatment plan. Trying to be as inclusive but mindful of how you prevent fractures moving forward. Type 4 is moderately severe, and the fractures range in severity. Okay, so it's not quite as severe as type 3. The diagnosis can be made at birth, but because of the lack of severity, it usually occurs later. Once there's that moderate to severe growth retardation or limitation as well. You may notice a light blue sclera in infancy, but again, as they grow, it may fade to white over time. They may have brittle teeth. Again, you're going to be looking at preventing fractures. Monitoring scoliosis, because again, if they have scoliosis, that's going to affect their chest cavity, and that's going to affect respiration. They may also have issues coping. They may have family or need family emotional support. Again, in OT, you're going to be looking at maximizing mobility and function. So there was a kiddo I had on my caseload with type 4 osteogenesis imperfecta. He was actually adopted through foster care. I don't know if it was related to frequent fractures or not. That just crossed my mind now. Why Child Protective Services, why he was there. And his foster family adopted him. He was shorter in stature. He had glasses. He had very low vision. His hearing was not affected. He tended to walk with a pediatric walker, is how he got around school, how he got around home, those sorts of things. I ended up doing a home visit in his home. He lived in a very rural place. There was gravel, scoria, rock around their entire property. And he couldn't reach to get a drink of water. He had fallen in the bathroom a couple times, taking himself to the bathroom because he couldn't fit his walker into the bathroom door. It was a really clunky walker. So what we did is I wrote up a report and we justified getting him a motorized wheelchair. It was state of the art. It had these big balloon wheels on it. It had hydraulic lifts on it so that he could get around his home without falling, basically. And so my whole report was geared towards preventing fractures, increasing in-home mobility, and because he had to go inside and outside since he lived on farm, and had to go over this really awful rocky terrain, we also justified the certain type of tires that were on the seating system. And so I took a wheelchair rep with me from our hospital supply store. We took measurements, we problem solved. I wrote a report for need for him, and his insurance, they paid for it. And so very exciting. He was one of the smartest kids I knew. He was very young, probably 8 years old, but his mind cognitively, he actually had skipped a couple grades in school. He just was that smart and that intelligent and very, very articulate. But again, with his wheelchair, it was narrow enough to fit through their bathroom, whereas his walker wasn't. And so part of our treatment and therapy, too, was to practice transferring, doing toilet transfers from his wheelchair, so that he wouldn't trip over the foot pedals, so that he would be able to transfer safely. And we did some modification to their bathrooms, made some recommendations for modifications, those sorts of things. So again, maximizing function, looking at his home environment, giving him something safe to prevent those fractures. To manage OI, you may also be teaching techniques for safe handling, especially of infants, maybe protective positioning types of things, how to safely move. There may be some types of activities that you want or that you recommend they avoid. Certainly, if somebody has osteogenesis imperfecta and frequent fractures, do not play football, do not play gymnastics or various contact sports, those sorts of things. And if so, like there's a video on cheerleading, if so, maybe modify those activities so they are less contact. Swimming is a very good activity because of the buoyancy, those sorts of things. We may be teaching energy conservation, as well as a healthy lifestyle, such as no smoking, monitoring or maintaining a healthy weight, avoiding alcohol, caffeine consumption, as we know that contributes to a decrease in calcium absorption, not collagen, but calcium absorption, and so you wouldn't want them to have that double whammy. And deplete the calcium in their bones on top of the collagen. That would be a nightmare. So again, we can really advocate that as OTs as well. Our focus for any medical treatment, I guess anybody's focus should be to minimize fractures, maximize mobility, increase safe independence with your activities of daily living, IADLs, maintaining general health practices. Certainly OTs and PTs will work together to work on this. OTs may be doing splinting or serial casting for broken bones, or that may be done in an orthopedic clinic. There may be braces to support legs, ankles, knees, and wrists, kind of joint protection. Those sorts of things. There may be orthopedic surgical rods implanted into the bones to support that long bone, because again, you see a lot of bowing, which is going to contribute to joint issues, muscle issues, those sorts of things. And so you may have those orthopedic rods implanted to promote that typical bone growth. They may be prescribed medications to help strengthen the bones. Again, that would be done by their physicians, those sorts of people. And they may have mobility aids. You know, they may have walkers, they may have canes, they may have crutches, they may have certain types of wheelchairs, those sorts of things. And so certainly OT-PT's role is with that, and with positioning and monitoring skin integrity, those sorts of things, especially with splinting if that's involved also. Here's some lower extremities, so you can definitely see the bone deformations here um, with the femur here and here. You can also see the tibia and fibula and how significantly bowed they are, which is contributing to that hip dysplasia as well, and sort of that frog leg type of position. So, a long time ago, they used to say that a baby with osteogenesis imperfecta should be carried around on a pillow and discouraged from moving, and really it's in the best interest of the child to be held, touched, to be able to explore movement, because immobility actually increases bone loss, decreases muscle mass, which is going to lead to weakness, more bone fragility, muscle weakness, fatigue, those sorts of things. If somebody's fatigued, they're going to be more likely to fall. And so, again, please do not carry them around on a pillow. People with OI cannot have children. OI does not affect fertility, but again, because of the skeletal problems, they would be at a high pregnancy risk for complications. Again, due to fractures, due to that genetic component of OI, those sorts of things. A couple videos to watch. One is just an individual living with osteogenesis imperfecta. They have some specialists that sort of talk about osteogenesis imperfecta. It's quite short, it's quite interesting. And then the next video is of a girl involved in cheerleading. It's a very touching video. It's my favorite video. I love it. And so that wraps up our section on osteogenesis imperfecta.